There is optimism that the combination of hydroxychloroquine, an antimalarial drug, and azithromycin, an antibiotic, have efficacy against the coronavirus based on a French trial that took place the first half of March 2019. These data are so new that the manuscript is still in press as of this week. The authors reported that a smaller proportion of 20 patients who received hydroxychloroquine, who we will call the experimental group, tested positive by day 6 when compared to the 16 control patients who did not receive hydroxychloroquine. Furthermore, of those 20 experimental patients, 6 also received azithromycin, and this appeared to improve the results even more. But let's take a deeper look at what the evidence shows. The first question we need to ask is, were the patients in the experimental group similar to the patients in the control group? It is tough to say since patients were not randomized. Patients only at one location in Marseille could get hydroxychloroquine. Patients at 3 other locations could only be in the control group. It is quite possible there could be differences in medical management at different hospitals. Also, the study did not pre-specify who could get azithromycin in addition to hydroxychloroquine. The protocol stated that antibiotics to prevent a bacterial superinfection was based on, quote, clinical judgment. Inherently, these 6 patients who got azithromycin may be different than those who got hydroxychloroquine alone. It is also very concerning that 6 patients were lost to follow-up. Originally, 26 patients received hydroxychloroquine and 16 control patients did not. 6 patients were not included in the data because 3 went to the ICU, 1 died on day 3, and 1 left the hospital on day 3. If we include the results from these 6 patients in the final analysis, we may have some different conclusions. This trial was also open label or unblinded. What that means is that people know if they're in the experimental or control group. Could this additional knowledge have affected a doctor's other management decisions? This is why we use placebos in many randomized trials to blind patients and/or the investigators from which group the subject is in. The measured effect, or endpoint, of this study was the proportion of people who tested positive after 6 days. A good thing about this endpoint is that it is objective. However, is this endpoint meaningful? What if you test negative but have lasting complications or serious side effects from the medication? Further studies need to look at whether an investigational drug helps people improve symptomatically, whether or not they're more likely to avoid going to the ICU, and whether or not they're more likely to survive having the virus. Lastly, do these results apply to a patient in front of me? Often, clinical trials will include patients that are healthier than usual patients. What we know so far is that this virus can be more serious in the elderly population and tends to be more serious in men. But the average age of the patients in this study was 45 years, and less than half of the patients were men. Patients were also excluded from the trial if they had certain conditions, such as retinopathy, which can happen in a lot of diabetics, or QT prolongation, which is a heart issue that if the patient had, would put him or her at risk for potentially deadly heart rhythm problems with this combination of medication. This video is not supposed to be pessimistic. In the end, I'm hopeful that the combination of hydroxychloroquine with azithromycin will have some benefit in patients with coronavirus. Since this is a new disease, the trial is an important first step to generate hypotheses for more robust, controlled clinical trials. From what we know now, however, I'm not sure we can say this drug combination is going to be a home run. I'm pretty new at making videos. My goal is to break down complex medical concepts for the non-medical public. If you like this content, please subscribe, and let me know if you have any other topics you'd like me to cover. If you have any feedback, please leave a comment below.